So Dr. List, to get into a little bit more specifics with some of our lower risk treatment strategies, could you tell me more specifically about sort of what supportive care means?
Yes, supportive care really are those adjunctive measures that we use that really don't address the cytopenias or the low blood counts, but really address the complications that can occur. So for example, if someone is anemic, severely anemic, and they need a transfusion, over time, with repeated transfusions, you can receive too many and have too much iron accumulating. After a period of time, that iron, rather than going into your normal storage sites, gets overwhelmed. It goes in places we don't want it, the liver, the pancreas, the heart. So we have one of those supportive measures that we use is called iron chelation therapy. So they're oral iron chelators, meaning they remove iron from the body, and there are ones that work either intravenously or as an infusion subcutaneously for prolonged periods of time on regular intervals. We use those for people who are transfusion dependent, who have an ongoing accumulation of iron where we need to remove that iron to help to prevent any of those complications. Another example is the myeloid growth factor. So these are synthetic hormones that will stimulate the production of white blood cells, specifically the neutrophils. If someone has an infection and they're neutropenic, antibiotics will help hold things in check for that infection, but they won't clear the infection without neutrophils. So we will often give these myeloid growth factors such as GCSF or GM-CSF to help stimulate the rise in white blood cell count to help fight that infection.